Well, I've been a doctor since, let's see, I graduated in '69. So I've been a doctor a long time, but I've been in addiction medicine for the past 7 or 8 years. And what brought me to the field? My son was a heroin addict for about 6 years. He just finished his 5-year clean time on the 3rd of March. So he's been doing well. So I've been there, done that, worked with addiction. I understand it. I understand the folks that have the problem. I also understand the parents and the loved ones that get affected by it as well. And so it's really a passion of mine to help these people and to educate them to the disease that they have, because indeed it is a disease. In addiction medicine now, it is not a behavioral issue, it's not a behavioral problem. It is a functional disease of the brain that occurs because of the effect of drugs. I love this program because everybody that I speak to here, especially, always tells me how people here care about me. And I like to think that I'm part of that caring system. And it goes anywhere from Lisa, who is the director, to the therapists that show true compassion and care for the patients. And I think that is the most important thing. They are not just numbers, there actually is some personal interaction with the people here to help them get to their goals. I treat them the way I would want them to be treated. I would want my son to be treated, or anybody to be treated with this chronic disease. I try to give them compassion, understanding, that's number one. But I treat them like human beings and not behavioral problems. When you have a smaller program like this, you actually get to know your clients much better. Versus a larger program that I've been medical director prior, people tend to get lost in the system. This is so much more, it's a caring program, basically. And I'm just telling you that because of what the patients tell me. Lisa's wonderful. Lisa is right there in the forefront of, she helps me a lot, because if I have a patient that needs to have personal interaction and I'm not available, she will dive right in and help the patient feel comfortable and take care of the patient's needs as well. So she's kind of like a mother hen, you might want to say, to a lot of the clients, and they realize that and they understand that and love her for that. It just doesn't exist in other programs. They may have an open door policy. Basically, if you have a problem, you walk in the door. But I can tell you, it's not the same. This is more like a family approach rather than just business.